Okay, I think we're going to start. I'm going to share also my screen. We're talking about reversing physical aging, which is basically a scientific word for rejuvenation. So I will use the title also rejuvenation. And so here it is. So rejuvenation, I think this lecture will really fascinate you because it fascinates me. I've learned really, really a lot with doing a whole model on longevity, and I'm working on an artificial intelligence program on longevity, but also on reversing aging. And basically, to live long, you need to reverse aging, to rejuvenate, not just try to slow down aging. That's not a quality of life you can obtain at that moment. Now, what is very surprising is that it's not just hormones or it's not just nutrients. It's also exercise, lifestyle, diet, but also positive psychological attitudes and even spiritual attitudes that make you live longer. Centenarians, for example, are quite spiritual. And that's maybe one of the reasons why they stay healthy much longer than other people and live longer. So let's look into some of those details. They're sorry, they're working on my screen, but they're going to pop off my screen here. Sorry. Um, I'll go back here. So actually, what I'm going to explain here is just the tip of the iceberg, maybe 1/200th of the model on longevity, which is 12 sessions of 2 hours. But I'll try to give you some teasers so that you really get interested and motivated to take care of yourself and of your patients if you're a physician or health practitioner. So, for example, if you're positive, optimistic, hopeful, happy, that makes really physical aging decrease. You're biological younger. Here's one of the studies, and it's just one among many others that done on more than 4,000 Chinese old adults. And it was seen that those who had a positive psychological states like happiness, they felt safe, they had hope, they were positive, compared to those who had negative psychological state who felt unhappy and lonely. Well, were biologically younger. And those who had negative psychological states compared to those who were positive psychological states were almost 2 years older. So just trying being positive can maybe make you live 1.5 years to 2 years longer. And that's just, I would say, one of the few studies. There are studies showing that also optimistic people have less wrinkles and so on, about 25 to 30% less wrinkles. So it reverses aging to be positive. And here, for example, we know that for longevity, stress is the main factor. If you have low chronic stress, you can live up to 15 years longer than somebody with that is highly stressed. And this is why we all should feel good. We should feel good all the time. That's low chronic stress, scientific way of saying you feel good all the time, like a basic of happiness. So here, for example, in a review study that reviewed many studies showed that actually those who had highly perceived stress had greater skin aging. So they were on all the skin scores, they scored worse. And like you see here, you see this person looks normally is the same, but you see looks older here. And that's typically what happens with perceived stress. You can be up to 10 years older looking. Telomeres also in those who are women have high stress are about a decade older. So that means also that the person who has that will die also sooner. And so there's more wrinkling. There's also more pigment spots, as you see here. There's more barrier problems. The skin dries out, doesn't keep the water inside. And so here in this study on chronic psychological stress, it was clear there were many reasons to be older. There was more inflammation. People are chronically stressed. They had more oxidative stress, so more free radicals. The cortisol axis is much more activated. We know cortisol is very good, but not if it stays high on high level all the time. Then it eats up the tissues. It makes more breakdown. There's also an impaired barrier function of the skin, so the skin dries out. And there are also adverse effects on collagen and elastin, meaning that the skin gets thinner and less elastic. And that gives really a premature skin aging. Um, so also we know that the diet is very important, and you can reduce wrinkles actually, or even revert wrinkles, partly at least, by improving your diet. And here, for example, it was shown that old adults who were aged 80 or plus, they had more skin wrinkling. Those who had more skin wrinkling were biologically older. Their general health was worse, and they had also less ability to do daily activities. So they had more handicaps. And so wrinkling is when you look at a person with wrinkling, you know that that person is not optimal health, doesn't have an optimal health. Also, they had lower body mass index, but when you get older, often they lose a lot of muscles and the body mass index goes down because of lack of muscle. They had also lower DHA levels. DHA is really a marker of aging. The lower it is, the older you are in general, biologically. So there was skin wrinkling is a good marker of health status, was the conclusion of the researchers here, and particularly well for women. And aesthetical surgery or aesthetical procedures won't really correct that. Hormones do, and some nutrients also. We'll see what nutrients can do on skin wrinkling, and some results are really surprising. They're much more efficient than you think they are. You can also drink water. Just the fact of drinking enough water all the time helps to have less wrinkles. You see that if there's an adequately humid environment, also the environment, you drink water, but also around you. And if you're put in dry environment, that increase the wrinkle depth and roughness. So dry environment, you see there are more wrinkles here. Huh? And here more wrinkling. That can be thus wrinkling can be aggravated by a dry air and also not drinking enough. And also, alcohol is one of the worst drinks to drink if you want to look young. Let's look at some of the data because there's many studies going this direction, but I think you would be surprised how bad alcohol is for the face and the wrinkles that then appear. If you're a light drinker, you drink regularly, but generally maximum one drink a day over decades, or drink 1 to 2 drinks per day, that's moderate drinking, or you drink more than 2 drinks a day, or you drink sometimes heavy and sometimes not, binge drinking, or you are really abusing alcohol, there are big differences in the appearance of your face. For example, there's almost no wrinkling in light drinking. There's small but measurable increase of 5 to 10% wrinkles. And there's slight redness due to the vasodilation caused by alcohol drinking. There's also some facial volume loss. We know the fat of the face disappears and the muscles of the face disappear somehow. So you get a little bit older by drinking even 1 glass or less per day. If you are moderate drinking, you drink every day during decades, 1 or 2 drinks, you have 25 to 35% visible facial aging on average. And there's also more collagen changes and vascular changes. So you already have some of the aspects of an alcohol abuser. And if you are really heavy drinking, that's more than 2 drinks per day, you have 30 to 40% more wrinkles and facial aging signs. And there's 40% increase in facial telangiectasia, little spots like this, you see, telangiectasia, visible blood vessels. That's typical for alcohol drinkers. And if you're really an alcohol abuser, you drink probably 3, 4, 5 drinks a day or more, that's even worse. So actually, heavy drinking, you appear 4 to 6 years older, but it's worse when you're really an alcohol abuser, which is not surprising. It is also more collagen loss, inflammation, skin barrier damage. More than 2 drinks a day is certainly much too much. And we don't talk about the decrease in hormone levels. You can decrease your growth hormone level, which is one of the major two hormones to reverse aging, by up to 80%, 75 to 80% by alcohol drinking. Uh, so you see, you have worse aging each time. It's more and more aging. Most severe changes, up to 5 years of accelerated visible facial aging, and more. This is several studies that say that. So it's really something you need to watch out. Uh, Alcohol, probably good, 1 or 2 days a week, 1 or 2 glasses, probably not much problem. But if you drink more, then you might look older, and you might age also older, because if you look older, you also will possibly die sooner. And why would you die so soon? Life is so wonderful. I find it fantastic. Of course, there are troubles, but that's just experiences that you overcome. So, and the rest is fantastic. And I would say, even trials or hardship have some fantastic learningship. So, fasting also. This is a very good study done by the group of the Italian researcher Walter Longo. And there were 71 healthy Italian adults. Some were young, some were old, between 20 and 70 years. And they did 3 diet cycles once a month of about 5 days of fasting mimicking diet. So they ate about 700 calories and 5 days a month. And what that gave, actually, when you did those 3 cycles every month during 3 months, the actually markers of aging and age-related diseases and of diabetes, cancer, cardiovascular were down. The body mass index were down, and the body weight, which is not surprising because they ate less. They had also less trunk and total body fat. The triglycerides were lower, and systolic blood pressure and diastolic pressure were also lower. So everything improves. Cardiovascular, on body composition is improved. And biologically, they were 2.5 years younger. So it means that possibly, maybe it's not so, but it probably is, that if you do that the whole year, 5 days a month, and I do more or less 5 days a month, well, that you might gain maybe 10 years major biological. I don't think that. I think that at the end it calms down a bit, but basically you can win 2.5 to 7 years younger biological age by fasting 5 days a month. So your body, your intestines has a rest. So there are many things you can do, and also pollutants. They cause physical aging. And among the pollutants is tobacco. We know that tobacco smokers on average die 5 to 10 years younger. It's one of the worst pollutants because there's about 6,000 pollutants, different substances that are toxic in tobacco. And you see these twins are both smokers, so they look older. But the one who looks oldest, who has the most wrinkles when you compare, huh? These identical wrinkles, there's more wrinkles here, was a smoker, started smoking 14 years earlier. And that gives an impact also on long term. Even his lips are thinner, for example. So there's more atrophy. The hair has less volume, for example. So if you're a smoker, stop smoking, do something else. There's a hormone like oxytocin can help you calm down smoking, for example. Each time you feel uncomfortable, take oxytocin, for example. And what about micro and nanoplastics? There's a lot of us on the internet now on it, and I studied it deeply, and I can tell you, I think it's the main endocrine pollutant. So it means that it's the pollutant to decrease the hormones the most. Uh, at least it's the most frequent one. We all have about 7 grams of plastic in our brain, and Alzheimer patients, 36 grams on average. So It probably promotes Alzheimer. It does it in rats. When you give a lot of plastic, they get Alzheimer. And you see that in a US general population, it was seen that when you check in urines the secretion of plastics like the urinary phthalates metabolites, that there's a significant decrease in the testosterone level. And we know that testosterone is so important for masculinization, but also for energy, for body muscles, also in women. And this has been shown also in women, not just in men. And in the boys, at least, ages 6 to 12 years, if you are, if you're in the boy is in the 25% highest levels in the urines of the D-ethyl ethyl phthalate, so one of the plastic metabolites, is 87% decreased in serum testosterone. Of course, they don't have much testosterone, but then they have even less, much less, if they're in the top plastic consumers and excretors. And the phthalates are what makes a plastic flexible. It's not the hard plastics is more bisphenol, and phthalates are the one who makes the plastic flexible. So if you drink in a plastic bottle that's very flexible, you'll be sure to have lower testosterone levels the next day. The boys ages 12 to 20 years. Also, there were inverse association, meaning the more plastics in them, the less testosterone, but it wasn't so significant as in very young boys. And then men ages 20 to 40 years and 60 to 80 years generally also had inverse relationships, but not very statistically significant. So it was a slight decrease in testosterone. But men ages 40 to 60 years, they had they had of two of those phthalate metabolites they had um, if they were in the highest consumers in the highest excretors of those plastic compared to the 25% lowest, 25% highest, 24% less testosterone levels. But for one of those, it was even 39%. So you have a lot of different plastics in your blood and you excrete the metabolites of it, you metabolize them and it all gives you lower testosterone levels if you have a lot of those. So don't drink in plastic bottles. And I would even don't eat with plastic forks. Don't eat in plastic plates. And if you have vitamins and nutrients, try to have put them in glass bottles. Men ages 60 to 80 years already have the happiness of being in that category. There were also in general inverse associations, but not statistically significant. So there were lighter changes. But anyway, that means there's so many plastic we consume, and this is just some of the plastics that are screened here. So if you have no plastic, you probably look like this. If you have average plastic, you probably look like that. And if you have high plastic levels, you're in the upper 10%, you probably look like this because this is severe testosterone deficiency. This is typical for moderate testosterone, and this is how a man with a lot of testosterone looks like. And you have also studies with women showing that also for the female hormones. But there's so many information that I'm trying to see how important is you to get conscious that you need to avoid aging quickly, and you not only need to slow down aging, you need to reverse aging. The best way to stay healthy and to live a long and probably much more joyful and happy and healthier life. Then in my model on reversing physical aging and rejuvenation, there's a section on the regenerating hormone therapies, the proofs why the hormones really can reverse aging. The studies are overviewed. And actually, there are several hormones who are more powerful to reverse aging and to get this sort of beautiful body, like in these statues. Thyroid hormones, they provide a lean face. The testosterone gives to men and to women a firm, muscled body. And the dihydrotestosterone, that is I would say, super male hormone that masculinizes people. They give a masculine body in men, and they also help in genital development, both in men and women. So if the genitals are regressing, there's a lack of dihydrotestosterone. And estradiol is the feminine hormone that feminizes a woman, gives the female forms, beautiful breasts. And progesterone is the other female hormone that prevents excessive breast development and even protects against cancer. So if a woman has a large breast, she didn't have enough progesterone to counter estradiol effects. And then cortisol is a fantastic hormone. It's not a dangerous hormone if you can work well with it. It decreases the inflammation in the body and it prevents the age spots that are actually Addison spots in older people. Most of those irregular age spots are due to the lack of cortisol, and then another hormone is secreted to try to stimulate the cortisol production, ACTH, that gives this irregular pigmentation. Aldosterone is a hormone that holds the blood pressure up. So if you don't have enough, you want to lay down all the time because you don't feel good in your head if you stay still. DHEA is an anabolic hormone that protects the body against cortisol. So with aging, DHEA declines quickly and then aging accelerates because cortisol declines slower and there's an imbalance and there's too much catabolism. So you need to add DHEA quite quickly around age 30. In general, it's necessary to add it to most people. Melatonin is a hormone that makes you sleep, okay, but it also opposes premature aging. It prevents to have stroke at night, for example, makes blood more fluid. But it also opposes premature aging. It blocks free radicals, especially around the brain. And then the growth hormone NIGF-1 is a youthful hormone. It gives you youth. It reverses, it improves your body composition, decreases the fat, increases the muscles, thickens the hair, the skin, and the muscles. So it's a couple of hormones, growth hormone and IGF-1. It's insulin-like growth factor 1. Vasopressin is a hormone that hydrates the skin and the body and decreases the fine wrinkles you have on the face. And people have sunken eyes in the orbits, they look older, but it's because they are lacking vasopressin. And those fine wrinkles, the fine lines there, you don't need to give Botox. You can give vasopressin, works much better to lose wrinkles. At least the sharpness of the wrinkle, the depth of the wrinkles. And one of the proofs that there is really premature aging due to low hormones and the hormones can reverse it is the studies that show, for example, that if you're lower in IGF-1, which is probably the major hormone that reverses aging, if you get to lower levels, the lower the levels of IGF-1, the higher your biological age is, the more there's premature aging in adults and in normal adults and adults with disease. Also, if you're still within the reference range here, for example, you have a decreased leukocyte telomere length. So the telomeres are the ending of the chromosomes and they shorten with aging. And they shorten quicker with aging if you have a lower IGF-1 levels. And on levels that are still within the reference range here, for example, here, that's the reference range of young adults, the upper and the lower limit, and here's the mean. You're still here in the reference range. And well, you have more facial aging, more skin wrinkling, and a more dry and thin skin in normal persons. And then obesity is also, there's more obesity if you're in the lower half of the reference range of young adults with your IGF-1 levels. So you need to be higher. And there are inverse associations, etc. So you really here, you don't need to be below the lower limit to have problems. You already have problems if you're in the lower half of the reference range with IGF-1, more visceral fat mass. If you're near the lower limit, of course, if you have a level that is here, it's much more, you have much more risk of having problems than if you're here somewhere. So the lower, the worse. And the optimal levels are probably in the upper half of the reference range. So what I propose to reverse aging, you first need to tackle the most important problem. Of course, you tackle the diet, but otherwise no hormone therapy works. But the hormone therapies are the major treatments to reverse aging safely. And they even make it so safe that you can have less cancer with the hormones, less cardiovascular diseases, and feel much better, sleep better, more energy, and things like that. And so basic hormone therapies that can reverse aging possibly 10 years back in time. And I have the data also showing that when you take these therapies, you also really live longer. So by rejuvenating you, actually. And so this is the normal aging. Huh? And that's those people here, if they have it at the regular timing, they get that old, it's possibly due because they don't know that there's a lot we can do to delay that decline and probably to shorten the time you live in the decline state. So aging, this is you, these people like this, they age too early. And the part of that aging is avoidable. And probably that sort of aging is almost totally reversible if the not only hormone therapies, but nutritional therapies, diet, psychological attitudes, lifestyle are improved. And you see, much of aging is completely unnecessary. People think, oh, it's a normal phenomenon. Yeah, it's a normal consequence of negligence, not taking good care of yourself, because it can be safely reversed. Not everything, but much of it. And with hormone therapy, that's the most powerful way. So basic hormone therapies that can reversing is thyroid, the vasopressin, sex hormones, the female and the male hormones in men and women. And they will really show up visually. You will see them. And adrenal hormones, cortisol, DHA, aldosterone, also will give visible effects that you can see on the body of the person. With DHA, for example, certain time I give to women who had the droopy belly, DHA, and they did exercise there, but it didn't help. But the droopy belly completely disappeared with a relatively higher dose of DHA and exercise. So I'll just give one example because there's so much to see that I'm just giving you a teaser. If you have an untreated thyroid deficiency, you look, let's say, normal to other people. That means a little bit swollen up, a little bit obese, and tired in the morning, and suborbital edema and overweight. And this is what happens with thyroid therapy. It decreases the swelling of the face and of the lower eyelids, and you look slim. That's and that's easy. You just treat the thyroid deficiency. Find a physician that does it, and if you're a physician, please learn that. It really helps. Do it on yourself first in your family, and then you will be so enthusiastic that you'll be tended to do it to other people. And there's a lot of information and also in the models that help you to do it. My dedication is to teach a lot of health professionals and mainly also physicians to help people out. That's the best way I can fulfill my mission, if you allow me to use these words. Then there's another session of 2 hours where I'm talking about going a step further, not just reversing 5 to 10 years back aging, but going further, maybe something like 15 years or hopefully even 20 years. That also already has happened. Subcutaneous hormone injections that rejuvenate you physically 10 to 20 years back in time. It's possible. Of course, it's always with a patient who does other things, who does a very good healthy lifestyle, has a good diet, really improves the diet and things like that. You need to join several factors together, but you need these hormones to go so far. And subcutaneous injections, there's growth hormone treatment, IGF-1 treatment, insulin treatment. Yes, even insulin in people who don't have diabetes, but then in very small doses because insulin increases the absorption of amino acids, the building blocks of our muscles, of our bones, and of most of our tissues. MSH, treatments like melatonin, bremelanotide, and relaxin treatment, which is I'm probably the only one in the world who's taking it because the injectable has disappeared out of the market, and I'm trying to find somebody or firm who can re-put that on the market. The relaxin is the one that gives so much elasticity to the skin that you get this skin elasticity back all over all the bodies. The one that makes that if you're a woman is it pregnant, she has a big belly, and that belly goes back without any stretch marks. That's the action of relaxing, and that's what older people need. And so this is, I'm going just to show you what insulin can do to reverse. This is a physician who didn't have diabetes but was very thin and had narrow lips and thin hips and buttocks, thin neck, not much muscles, looks thin. And by taking insulin, looks how he looks. The quality of picture is not so good, but you see enough. There's a normalization of fat and muscle mass. So I take insulin, but I take just 2 units a day on average. So larger shoulders you see and larger pelvis. And everybody knew that without knowing it. Why? Because Banting was the first to treat children with insulin, diabetic children who had a very bad prognosis. They died, were meant to die early because, and they looked also older, like here. Look the change with insulin therapy. But the look at the body of this girl. That's in the 1920s here. And that how was how she looked. Looks like an old woman, no? And see the difference with insulin. That's what insulin does. And if you don't have diabetes, you need much lower doses, but you do have that type of effect. It's isn't it much better here? So I have also a session on scalp hair rejuvenation with hormone treatments that it's very complete. Takes 2 hours with all the data, but also the practical tips that you need to know. And there's male pattern hair loss due to low testosterone, dehydrotestosterone. Men take many products to keep their hair. I should have lost my hair because at age 40, I was losing my hair, the recession here, and I had a crown here appearing. Fortunately, I found the good balance for my hormones. And basically, it took me 3 years for that. And it's very simple treatment. So here's a study, for example, that showed that healthy young men, they don't have too much androgens, they have too little androgens. They're low in testosterone and dehydrotestosterone. But there's a ratio of dehydrotestosterone that is increased. And that happened to me. I was low in testosterone and my dehydrotestosterone was average, was not high, but I was losing hair. So what I did, I took testosterone and I added finasteride, which is a blocker of the conversion of testosterone to dehydro. Partial blocker. Never block totally. You still need to have high levels. So my levels of dehydrotestosterone are certainly as high as they were before, but comparatively, I have more testosterone. And fortunately, I think my wife likes that because I still stay young and a good lover. I suppose so. I hope so. Just ask her. But I can tell you what a quality of life. It's not only for the hair. It's the whole quality of life that improves when you take testosterone. But please, for men, do not take finasteride alone. Propecia is finasteride, but don't take it alone. If you take it alone, it will give you erectile dysfunction, and it can give you an inflammation on the scrotum that it's hard to tolerate because it decreases too much the dehydro. You may not decrease dehydro, you have to proportionally increase the testosterone. So never take finasteride as a man nor as a woman is my advice without testosterone to make it safe. And you see that men who are at younger age have rapidly progressing hair loss, they have a higher risk of disease and premature death, possibly due to the testosterone deficiency that is behind there. And there are many studies showing that. And here, this is typically what we can have. You give about testosterone transdermal, 50 milligrams per day, can be often enough in young men. And among young men, it goes quicker to get the hair back. In 6 weeks, 8 weeks, you already have the first result. Well, you need to wait 4 months with an older man of 40 years, for example. So that's about the average dose that is given of finasteride. That's a sort of progesterone. It's a synthetic derivative of progesterone that partially blocks the conversion of testosterone to dehydrotestosterone. So after 1 year and a half, this is more or less what you get. There's also creams you can put. In women who lose their hair, for example, you can put melatonin cream in the hair and it makes their hair grow back. Melatonin oil. Um, So skin rejuvenation and repair can also be done with hormone treatments, including topical creams or oils. So here, facial hormone creams or oils to reduce wrinkles. You have, for example, topical estrogen cream in a group of women before the menopause, so where they were still menstruating, and they had skin aging. They had skin biopsies done, and what was shown, they received about 1 gram a day of 0.01 estradiol. So that's basically about 10 micrograms of estradiol, I think, locally, and they had or milligrams, I think, and then estriol was a higher amount creams on the face. And what happened is that with the estriol that was in much higher concentration, results were better. Wrinkles disappeared by putting the cream on. And there was 61% decrease in wrinkle depth and pore size with estradiol, but again, it was 30 times lower concentration because normally estradiol is much more potent than estriol. And the skin moisture was better. There was more elasticity, more firmness to the face. So it really helps to just to put um, a topical estrogen cream. Now, how to reduce age spots with hormone therapy? And one of the ways is like in Addison's disease, you see they have pigmentation, melasma, and irregular pigment spots. And that was one of the drawings that accompanied the first publications of Dr. Addison, who discovered this disease. And basically, it points to high ACTH levels. I recently had a patient who also was adrenal deficient, and his ACTH levels were quite high. And this gives hyperpigmentation. It's the hormone of the gland that is there to stimulate the adrenal glands that are above the kidneys to make more cortisol. And if there's not enough cortisol, it keeps on increasing, being secreted, the ACTH. And when you see this, an 80-year-old man that had a lot of weight loss because you don't absorb, you're not hungry when you have Addison's disease, and he had a lot of skin pigmentation all over the body. Like you see this sort of pigmentation with strong irregular spots here all over. And he had high ACTH, extremely high, under 26. His cortisol level looked normal, but when they did the stimulation test, they yeah, also an adequate cortisol response. But the reason is that the stimulation test is much too high dose. 250 micrograms ACTH is much too high. Normally, it's 1 microgram ACTH stimulation test that should be done. So they did a 1 microgram ACTH stimulation, and there was almost no cortisol secreted. So there was a weakness of the adrenal glands to make cortisol. And so they diagnosed Addison's disease. They were fairly certain about that. They gave hydrocortisone 50 milligrams per day, which is not a high dose because only 50% or 60% of that is absorbed. And there's a decreased skin pigmentation with an increase in body weight. And 1 microgram SATH stimulation test really helped to make the good diagnosis because he was cured of his problems and he also increased in weight. So you should do a 1 microgram test if you want to do this test for diagnosis. Also, the melatonin oils can be good locally. And so melatonin oils can make your hair grow back, but also the face. It can decrease the pigment spots, especially if you add vitamin C to it. And you see this is the pictures of Dr. Tutino, was the great pioneer in melatonin oils. And you see that the pigmentation decreased quite a lot. This is a real picture. It's really patient before and after. And the change after 9 months with melatonin, the skin is much less pale. It's much better. Now, what about how do you rejuvenate the face? Basically, not just the skin of the face itself. Well, first of all, you have a lot of different faces. You have swollen faces, you have sagging faces, aging faces, you have dehydrated faces, faces that lack body water. And you see, you have then sort of crow feet wrinkles is a sign of dehydration, sharp wrinkles. Every wrinkle is sharp here. And that's typical for aldosterone deficiency or vasopressin deficiency. Those are the two major hormones that keep water in the body. And it's normal that with aging, we slow decline in their secretion. So we need them. You do have to be careful if you have high blood pressure with these hormones because especially aldosterone can increase the blood pressure. Vasopressin is one patient on four maybe, but not in all patients. It's not so strong for increasing blood pressure. So before you see all these wrinkles, and this can be improved by fludrocortisone, doses around 100 to 150 micrograms. Normally 100 micrograms is enough, or the bioidentical one, but it's very difficult to get, 2 times 125 micro, or desmopressin, and you see what the changes you could obtain, much less dehydration of the face. And what about a puffy face that you swell too much in the morning? Well, that's typical for low thyroid function. And everybody knows the Mona Lisa. But what many people don't know is that she's hypothyroid. You see here, swollen lower eyelids, yellowish tint, the lack of eyebrows, especially outer third, but also the rest of the eyebrows is missing. And there is a xanthelasma here, piling up of cholesterol. And the hair looks like it's diffuse loss. It's quite thin anyway. And there looks like a goiter here. And that's not me saying it. It's a study published from researchers from the Mayo Clinic. And so if you give a treatment, what could possibly have happened in that time? There was also goiter area. That would be the Madonna. So that would be a Madonna without hypothyroidism. Of course, this is a joke, but anyway, look, the change that thyroid hormones could give. Now, if the face is too hollow, with aging, many people get a hollow face. Well, that's usually due to a lack of cortisol. So you see, this person has a hollow face and is very tired, has dark circles under the eyes, is brownish tint, and it was discovered as having Addison's disease, which is thus a lack of cortisol because the adrenal glands are weak. And look, the change in him was hydrocortisone treatment 2 years later. Of course, after 4 months, you already have that change. Basically, it's a muscular face, light colored Caucasian skin, much better. The change is cortisol. Cortisol is not bad when it's given when it's necessary, in balance with DHA, of course, the protector. Upper body rejuvenation. We have a whole session on all different parts of the upper body, how to rejuvenate them from the neck on to the abdomen and the back and the arms. And one of the problems that men may encounter is having breast formation, breast development. That's usually due to a lack of female hormone, an excess of estrogens and a lack of testosterone. And also growth hormone deficiency can be behind it. So if you treat with a dihydrotestosterone gel that cannot, so testosterone can convert to estradiol, but dihydrotestosterone cannot convert back to testosterone and thus not to estradiol. So a dihydrotestosterone gel that we have here in Europe is 2.5%. And you can also give a local testosterone, but then you need to add in the oil or cream 0.1% anastrozole, which is an aromatase blocker of the enzyme that converts testosterone to estradiol. And so that really is enough to improve. If it's enough, then you need to give the estrogen blocker by mouth. And you need to give a testosterone therapy for the whole body and growth hormone treatment. And then you really have even better effects. But if it's just small and local, this may be sufficient to give this dihydrotestosterone gel. And droopy breast in women, for example, poorly developed breast and thus no, and droopy breast are a sign of estrogen deficiency. If you give a treatment, what happens? The droopy breast become not droopy anymore. After 4 months in women, if they give the right dose of estradiol, plus progesterone orally or vaginally to protect to having not too enlarged breast. And no surgery is necessary. So generally, I don't have surgery necessary for women who have beautiful breasts once they are treated. If there's breast abnormality, of course, that can be no different. Small breast also, it can be substantially increased in 1 year time. It takes about 1 year. And if in younger women, in one woman around age 20, 22, 24, but if a woman is older than 30, 35, you need to add other hormones to make the breast bigger, DHEA and growth hormone, and possibly also IGF-1. And they have to improve their food because women who eat whole grain bread actually have almost 3 times more female hormones in the stools and 20 to 40% less in blood. So the lack of estradiol can, due to a wrong food intake, because the cellulose of the whole grains that you eat that are not sprouted are glue in the, and most 60% of the estrogens and sex hormones are secreted by the liver in the intestines and are reabsorbed later. And that doesn't happen well, that the cycle is interrupted. So you cannot use these hormones, they are lost in the stools. So whole grain bread is absolutely not good for people with low sex hormone levels. And then the lower body rejuvenation, also sagging inner sides of the thighs, for example, you see here sagging inner sides, is typically due to a lack of anabolic hormones like growth hormone, like testosterone. And so there, and what you can do, for example, you see that growth hormone deficient um, adults who had growth hormone since childhood, so they are generally also smaller if they didn't receive growth hormone. And you see that their skeletal muscle fiber are less in the quadriceps muscle of the thigh. And so if you give them growth hormone and IGF-1 and testosterone, you have this sort of improvement of the get firmer thighs. And there are many slides also on how testosterone alone can help, especially if intramuscular injections are given. And what about the sensors? The sensors also age, and there are many hormone and nutritional supplements that can help. And so I see that for the eyes, I see that for the touch, I see that for the smell, for the taste, and the vibration feelings, and all that ages, but that's all can be delayed or decreased as the decline and even reversed. And so I'll give you one of the idea where age-related macular degeneration, where people get blind, actually, you see that the visual acuity improves and doubled actually, and that healed by taking 3 milligrams per day of melatonin after several months of intake. You reversed the age-related macular degeneration. And it was just not one patient, there was a whole group of patients that improved. So we do have tools to reverse the irreversible. And now, what about rejuvenating scalp and hair and the body with micronutrients? Well, micronutrients are surprisingly efficient there for the hair and for the body. So uncombable hair is typical for biotin deficiency. You have also copper deficit can give uncombable hair with a lot of curls. Zinc deficit looks like this. And omega-6 fatty acids, the hair get like fizzy, like a bit African hair a bit, and it's also difficult to comb. And thyroid deficient is rough and coarse hair, difficult to comb too. So you need to differentiate if a person has problems or combable hair, what the deficiency is behind. So generally, lab tests will help you also in diagnosis. And if you want to regrow scalp hair with micronutrients, you have here, it is interesting that you first should think on iron. Because in alopecia areata, for example, where they lose hair loss in plaques, they usually, in a study at least, there was 58% decrease in the serum ferritin. So there was more than 50% decreased iron. The female pattern hair loss also 37% decrease, so more than a third decreased. And when you have diffuse hair loss all over and old hair with a round root, telogen effluvium, there was non-significant 16% decrease. In the alopecia totalis universalis, also non-significantly 12% decrease, but always a decrease. And when you look at iron treatment, this is before iron treatment, this is after iron treatment, you see clearly that there's more hair. that this diffuse loss that you see only a fraction was reversed with iron after 2.5 months already. It usually takes in older adults 4 months to see a difference with hormones, but with nutrients, it goes quicker, but it doesn't go as far as hormones do to reverse. And so we have dry, brittle hair, alopecia, patient, and also for oral zinc was given here before and after. You see the difference by giving zinc. So it's efficient. It's not something that is you cannot see. And then my favorite is MSM. You give oral MSM. I give usually a teaspoon per day mixed in water, powder. And after 8 weeks, you already have an increase in hair volume. And my impression after 6 weeks, when it's 1 teaspoon, you increase by 50%. And it gives keratin to cells. So this is really something that is very efficient if you want to have more hair volume and thicken the hair. So you can regrow scalp hair with nutritional supplements, and there are many: the B5, the pantothenic acid, the biotin, the iron, the zinc. The collagen peptides also have been shown in studies, and multi-nutrients. We don't have time to go all over this, but there's a lot of data in the model that I give. Now, what about nutritional supplements that make the body firm? Well, you see here that creatine, if you give a dose, you start with a starting dose during 5 days only, 21 grams, that's a lot. And then you go to about 5 grams thereafter for 12 weeks. And compared to placebo, you gain 2 kilos of lean tissue mass in people, older men who are exercising. And the leg strength is also better. They have more power in the muscles. But the best is even carnitine, 4 grams a day, 2 times 2 grams a day. In older adults, you give that for 30 days, just 1 month. And look at the difference: 2 kilos more total muscle mass, 3.5 kilos less total fat mass. Wow, what a change. And we know that carnitine is there to work in the mitochondria, gives you more energy. So they had fatigue and 40% decrease in physical fatigue and 45% decrease in mental fatigue. And no adverse effects. It's very safe. A meta-analysis showed that also fish oil significantly decreased the waist and hip ratio around many studies showing that. It's about 2 grams a day of fish oil is sufficient to do that. And now there's also a whole session of 2 hours on reversing the aging of the skin, the eyes, and the lips, and the pigment. And you see the pigment spots, for example, with pycnogenol. Pycnogenol is extract of the bark of the French maritime pine. This is the bark here. And it's a series of different polyphenols together that have antioxidant effects. So they neutralize almost any oxygen radical species, any free radical. They regenerate vitamin C, they regenerate vitamin E, and antioxidant enzymes. And what happens when you give it to women with melasma during 1 month, 3 times 25 milligrams per day. So that's not much, but it's given spread over the day. So it works better if you spread them in 3 divided doses. 38% decrease melasma area, and 20% of the remaining melasma was less pigmented, less pigment intensity. So, and also less fatigue, less constipation, less pains in the body, less anxiety. So it's a very useful way to be better on many aspects. To prevent wrinkles, silicium has been efficient, or silicone. 2.5, 5 milligrams per day optimally is 2 times 10 milligrams, or about 4 capsules a day for at least 2-3 months. And what you have then in the wrinkles, for example, is that there is more people having grade 1 wrinkles and less grade 2 wrinkles, which is more severe. And in the skin dyschromia by photo damage, there was 6% less participants having this irregular skin pigmentation. And the dry skin was also decreased. There were 45% more hydration, while it was 29%. So it's almost 56% increase in skin hydration. and the roughness of the skin was decreased by 7 times less at month 5, so really very efficient in the that it felt 70% less, sometimes less rough, but visually it looked also 33% less rough. And what about collagen peptides? You have to give 5 grams per day or more of that, up to 10 to 20 grams. I take it and it really works. Uh, 10 grams per day of oral collagen peptides for 8 weeks increases the hydration of the skin and the elasticity of the skin and skin vulnerability. So you really get a better, younger skin. And all the patients who take oral peptides, they also increase in fat-free mass. The muscles are better. Skeletal muscle mass is increased. And so they have less fat, more muscles. So in conclusion, is that you can do a lot. There's much more. I'm touching the tip of the iceberg. And I hope you get yourself treated as well as possible. And as a health professional, you treat other people well. What we have is we have here the board certifications in hormone therapy that can be done. And I really advise you to do that because it really gives you the basis. It's based on 2 books, the Hormone Handbook and Atlas of Endocrinology. You can really get a first certification. There's a little special price, so you have to watch that icon. You put your mobile phone on it. And there's also, you can do a board certification in longevity and quality of life. And it's based on textbook of lifespan anti-aging medicine, which is really very full of good instructions. And then you can also do a board certification in nutritional medicine based also on the textbook, the Nutritional therapy textbook. And that is really, really worthwhile because it really helps you to treat better your patients. And then I am happy to announce you that I'll be in Cancun in Mexico, and I'll give a 1-day workshop plus a lecture on the main session, gynecologist congress, and subjects will be testosterone therapy in women, hormone therapies in pregnancy, hormone therapies of depressive disorders, and there will be also practice sessions where people from the audience can come and I'll explain what they apparently have based on the physical signs and the complaints as hormone deficient and what they should do. And there's much more, of course, that will be there. There will be a free webinar on fatigue and energy with hormone nutritional therapies. And where you, if you still are tired after that, then is that you didn't follow the guidelines because it's really helpful to get out of fatigue. And November, there will also be a free webinar, but might be a peptide. I'm working on a peptide book now that I think will get people a lot of enthusiastic. It's a whole different way of looking at peptides and being efficient with it. And then I'll be, of course, in Las Vegas in the annual World Congress in December. You can get information about books, certification, diplomas, online courses. These are the icons, so feel free to get them. And these are the books. If you're a beginner in hormone therapy, I really advise you these 2 books. Even if you're advanced and you don't have them, it's really worth. You learn a lot. If you want to reverse physical aging, this is good. If you want to know more about growth hormone, you have everything on growth hormone. It's probably my best book there. And testosterone therapy, very rich on what to do for cancer or avoid cancer. These are the Nutritional therapy book, Lifespan Anti-Aging Medicine, that are bought for the board certifications. And this is for the board certification hormone therapy. And there's a model on reversing physical aging that is also translated into Spanish that you can download. You can always go here or send an email to channel @ and on hertoghe.eu to get more information. And you can send always emails here. And this is the evidence-based hormone therapy is the most valuable of all the courses in the sense that it's also the most updated, most easy to follow, but also very profound. So there's sessions on immunology, on hormones. It's mostly on hormones, reversing physical aging and hormones and nutritional therapies, inflammation, inflammatory disorders, female hormone supplementation, also about giving female hormones to breast cancer by other speakers, chronic fatigue and burnout, thyroid diagnosis, melatonin supplementation, testosterone in men, testosterone in women. And we have also then a second cycle with the hormone therapy consultation. If you just want to do one model and know a lot about, this is the model. And there's also adrenal hormone therapies, also one of the essentials, growth hormone and IGF-1 therapies, very profound course, psychological disorders and hormone therapies, longevity and hormone therapies, and also nutritional therapies, and sexual disorders. I think that's really a lot of very valuable information. Cardiovascular diseases is probably the most complete, and weight loss management, 10 courses. So I'm happy now to introduce you to our partners. And I think first is Dr. Irma Spinola, but I think you're not speaking, Irma, but you have a workshop in Cancun in June 6 and 7 on hormone balancing. And I think you're the one or one of the best hormone therapists in Mexico. So you get here the information on the WhatsApp or this Instituto de Capitación.org workshops, SGM, so in Cancun. And you can also always use our email. We can send then the address if it's too quick for you. And then there's Olivier who's going to speak. And I think, Nelly, it's later for you. Can you take out your video, Nelly, so that Olivier, for you to speak. Do I turn the slides then maybe for you?
Yes.
Okay, you can speak. We don't hear you.
Hello. Yes.
Now, yes, okay.
First, Thierry, for this. Oh, you don't.
Yeah,
Is it
I
is
hear
it okay
you.
now?
Yeah, now it's okay.
Okay, perfect, perfect. So I represent Sunday Natural, which is a German company based in Berlin, and we offer a large range of food supplements. And I wanted to introduce you to the world for skincare, hair care, and of course the youth issues, I would say. So you
Is
can
that is that the slides you want to show?
yes, the next one, please.
And the hair care. So maybe I can tell a little word is that Sunday Natural, you see, they have glass bottles, no plastics, except the top, maybe. So that's already an advantage, and they have very good prices. But you also have a policy of trying to have as least pollutants possible, as least additives possible, so that the quality remains very good. If it's like a sort of bio or organic health food supplements, no?
Yes, exactly. Yes, this is a philosophy, the True Clean label. We propose to our customers to remove all kind of toxic substances or potentially toxic, which are currently allowed, but we already upgraded our range by excluding this potential toxic substances. So we look forward and we don't wait for the regulation. And so, yes, we are talking about high purity ingredients with a very soft extraction system without the minimum of alcohol, the maximum of water or CO2, critical CO2 extraction. So yes, it's high quality and premium quality, I would say.
And
So,
you even also have very
and we have a
competitive
large range.
prices. You have a lot of choice and a
Yeah,
competitive
exactly.
prices.
For example, yeah, for example, with our collagen, we offer a collagen with 500 Dalton for molecular weight, which is unique currently in Europe because most of the provider provide around 2000 Dalton, which requires a daily intake of 10 grams. So with our new molecular weight, we can use only 2 grams per day to have the same effect because
So because you absorb
the
better,
weight is lower.
smaller
Exactly,
molecules
exactly,
means better
exactly.
absorption. So if people have malabsorption problems,
Yeah, it's a
then
trick.
they will do better with those products. Yeah, very good. I
Yes,
think you're the
exactly,
only
and
one
it's
also. Perfect.
yeah,
Great.
and with a price which is absolutely amazing, €8 per month.
Wow. And this is
So
your email, I think, no? Is
yeah,
this your email?
exactly. Yeah, you can contact us directly if you want any more information. as a customers or as a
Santé.fr, because you do the French part, but they also have
yeah,
Germany and other things like that. Yeah. So they're
exactly,
all
yes.
over
I'm in
Europe,
charge
I
of
think. Okay, good. Perfect. Thank you.
exactly, and we have
And
a
here you have a
yeah, yeah,
longevity range. Please.
exactly, yes. The next slide, it's a longevity range with to work on different aspects, especially when we want to talk about PQQ for mitochondria activation, biogenesis, or when we want to talk about autophagia. So any kind of we have the single product, the single ingredients, but we also have the complex which can work synergetically and which are more interesting. But sometimes for health for I would say practitioners, it's better to use different single ingredients with specific dosage to customize the protocol.
Perfect. Okay, good. Now I think it's for Nelly. Nelly, you want to, thank you, Olivier. You continue the good job. Nelly, you have a whole series of very good products because you're
Yeah,
very expert. And
yes,
tell me
thank you
about
very
one.
much for having me. So again, Nelly de Wust is really actually an extraordinary. I've been with the brand since 1983 now. I think we know each other that long. It's a brand that really provides one of the largest in the professional field of Cosmos certified formulation. But one highlight that really I feel gives you, more of a beyond like regeneration, and in line with your seminar today, I talked about the radiance oil. The radiance oil is a unique oil because as we age, melatonin, you explain well, really also declines, and we need to help regenerate and give all this nutrients to the skin. So this oil, we around the world, I have to say, is one of our top anti-aging oil. We've won prizes with Elle magazine. Really, it has like a super antioxidant, anti-aging benefit because you have this activity. So we have different complex of a plant in that oil. So you have melatonin at 0.003%. We have, of course, olive oil, the pure extraction, and we have, of course, argan oil, evening primrose extract. We have glycogen, and we also have hydrolyzed protein. So the combination and the complex of this oil gives you a full regeneration. So sometimes you don't think of using so many products to see the efficacy. You can actually see the results in a very short term, one day, and it smells good, it feels good, it's healthy, it's sustainable, and more importantly, it gives you the results.
So all the patients that use it, they confirm that it's really very good. You have more shine of your skin, it looks younger, feels better, and things like that. So I
Thank
can
you very much.
confirm
Yes, actually, we're very excited.
Okay,
Manon, and by
good.
the way, Manon
Yeah, Manon,
Filon. I
Manon, yeah,
just saw it
sure.
there. Yes,
Manon.
yes.
Manon
Thank you
Pilon
very much.
took over. But just to tell, in my family, my grandmother was the first of the family of the first founder of this brand that you took over, Manon. So
Correct, correct.
there's probably no coincidence.
No,
Um,
absolutely not. Absolutely. Thank you. Yes,
okay,
we're
thank
staying
you,
all in the
Manon.
fountain
Yeah,
of youth. Thank you so much for having me. Thank
thank
you,
you.
everyone.
And then um, uh, there's a I think I thought there was somebody who's going to talk, but yeah, you're going to talk, no, about
Sinai.
it. Sinai, Sinai. So Sinai, it's your turn.
Yes, okay. So hello everyone, all the friends of longevity and eternal life. And Thierry, thanks for having me. It's a great pleasure. I'm a big admirer of yours and your work. So my
Thank
name
you.
is Sinai, and I am actually the CEO of the first menopause clinic in German-speaking countries. We are fully dedicated to helping women that go through peri or postmenopause, and we do this in offering um, extensive range of hormone replacement therapy embedded in functional medicine and in orthomolecular medicine. Now, we are happy to pronounce that we are looking for doctors that want to join our team, and they should be fully passionate about the topic. dedicated and live a life that actually they preach, and should have a passion and an inner burning and desire to help women to live their best life, no matter how old they are or how young they feel. And I would be very happy if someone feels like addressed to contact us via the email address that we can see on the screen here. So secretary@hertoghe.eu. What is punct? Dot EU.
EU.
Exactly. Yeah.
So that's actually our secretary. So you can, and I'm very happy. I think I like the word passion actually that you in some way said. They have to be dedicated, but it's passion actually to help people, and I think you have that passion. So that's a big
I'm
part. And you want
actually
physicians like that.
Yeah, actually, and we are looking for doctors that live it, you know? It is like you. You
Yeah,
are an adult man, but you live what you are talking about. You live your medicine, you look good, you have a radiant aura, and this is what we want. When women come in,
yeah,
I want to show them, look, we can do so many things to bring you back to life, to glow. You just entered your queendom. Let us help you to maintain it, yeah, and to live the life to the fullest until the end of your, I don't know, of 120 so far. And
yeah.
it's about
Well, you're very conservative because the new data I have, I think I even counted 192 factors that can help you to live longevity, and 150 of those is at least 1 year more if you
Mhm.
do it perfectly. Of course, nobody does perfect, but so there must be some miscalculation because we would probably be 200 years longer. So I think we have to find a way of really understanding, but there's so many that can be done. It's unbelievable that you can, if you take a sauna, you live 5 years longer if it's 5 days a week. And if you don't smoke, you live longer also. If you, in fact, there's so many things we can do. And the hormones are really majorly important for that. And it's not just, of course, living longer, but it's living much healthier, much longer. So that's perfect.
Yeah,
Great point.
I think if we would have much more doctors that do the work that you do, not only preaching, living it. You know, I saw your
Yes,
family, I saw your wife. Everyone is glowing and in full swing. And also, of course, if you have the intention to have a long life, it must be fun,
yes,
right? So we
always.
want to stay woman and man. You want to be playful. You want to get up in the morning and take a big bite of the apple called life. And this is what we want to do.
Exactly.
Yeah.
Perfect. I have to go continue because there are
Thank you.
questions. Thank you
Thank you.
a
Thank you for
lot
your time.
for your and also for people, doctors who are interested. We're also hiring for in Brussels doctors. They also have to know French and English. So we already have one physician in training, but we're searching for more. So please, if you're a candidate and you live somewhere near, we're open, but you need to know at least French and English. If you know the Dutch is even better also. And here are all our partners. You saw here the labs, the Bionuruso from Mexico, Receptura Apotheke, Erfatarit Energetica Natura. We have a lot of very good partners, so I'm very happy to show. And if you want more information, the email is channel.at.hertoghe.eu, and you can also go here on all our social networks. Just put your phone camera on it, and then you can pinch on it. Okay, we'll see if we have some time for questions. I thank you for your attention, and I'm going to stop sharing here. And I'm going to see if there are questions. Wow, there's the chat box. No, here I have questions there. Question and answer. Perfect. Okay. Okay, so what kind of water do I advise to drink? Well, first of all, drink water from glass bottles or from tap water that is filtered. And if you want to get no plastics, you have to do an osmosis filter. However, the osmosis filters takes many minerals out and gives a sort of dead water. So you need to remineralize it, and that's very important. Now, I propose also alkaline water. People drink acid water. Coffee, tea is acid water. Alcohol, acid water. And they lose minerals through the urines when you drink acid water. So if you drink alkaline water, it's very easy to make alkaline water. You put some lemon juice in it, or you put some vegetables in it, like ginger, curcuma, or just any vegetables like cucumber, and you have alkaline water. And don't drink sparkling water. Of course, you can always take now and then, but don't do it every day. You need alkaline water that calms you down. Otherwise, and it gives you energy. While if you take acid water, you get heavy and you get heavy up the stairs. Do you believe in taking collagen powder supplement on a daily basis? Well, I take collagen powder, but it has to be hydrolyzed so that it's easy to absorb. So it really has a plus point. Otherwise, eating meat is maybe better. And if we could have the 500 Dalton collagen powder, I think it's even better because you have even a better absorption. And do I consider if taking capsules per day with a vegetable envelope could be bad? No, I don't think. I think if it's a vegetable or it's usually many capsules of pills that we take are from porcine intestines. So you can get allergic to it in certain sense. So I think vegetable capsules is good in general if it's real vegetables, not plastic. Since starting 10 milligrams cortisol, small dose testosterone, and Euteral prescribed by a doctor, I noticed water retention, bloating, and swelling. The dose of 1.5 tablets of Euteral suppressed my TSH below zero and made me feel overstimulated and balanced. Yes, indeed. If it's one patient in three can have a suppressed TSH by taking thyroid hormones and without any problems. But if maybe in you, if you feel overstimulated, unbalanced, it's too much. So you should probably stop 2 days and take then not 1.5 tablet, but 1 tablet. And the swelling is a little bit strange because 10 milligrams cortisol is almost impossible to, it's a too small dose. I never give less than 50 milligrams, so I'm not sure about that. You also received the treatment for Helicobacter pylori and slow digestion, bloating, and low energy. So it isn't better. Well, probably you need to go back to the doctor and do a real update because there's several problems that probably can be easily solved, but we need to find the cause. And I cannot find it with the information you give. How to improve our pigmentation aging? I think I showed you. Most pigment spots are due to adrenal deficiency, a lack of cortisol. So if you give the cortisol, you lose the excessive pigment. But also, you can give pignogenol 2 times 25 to 3 times 30, 50 milligrams per day, and you will lose a lot of pigmentation. You should also check if your food is good enough because if you eat bread or sugar, you neutralize cortisol and then you get pigment spots even with a good treatment. Here's from Vadim said, thank you for your webinar. I have a question about DHA supplementation. How to do it smartly? I did a blood test for DHA sulfate, then supplement with 50 milligrams of DHA. 50 milligrams is normally the top dose. It's the highest dose. I'm not sure you have that need. Depends on your age. If you're above 60 or 70, yes, but below, probably you need lower dose. My DHA sulfate still didn't reach optimal levels because you didn't control it probably correctly. If you take DHA, it stays 24 hours in your blood. So if you check 24 hours after, it's already back to the lower level of before. You have to take DHEA 3 days before the blood test in the evening, exceptionally, just before the blood test. And then after the third night, you check about 8 to 10 hours of the last intake in the morning, your DHEA, and then you have the average DHEA levels. But the estradiol jumped up, yes, because probably so DHA can convert to estradiol in coffee drinkers and alcohol drinkers. So if you drink coffee and alcohol, I think you will quickly convert to estradiol. If you're also obese, you convert quickly DHA and testosterone to estradiol. So you should take probably an aromatase blocker and stop the coffee and the alcohol at least on a daily basis. And then I'm a 50 plus male. Well, probably you need something like 35, 40 milligrams at age 50 or 52. My question here, Mandy. Very fit 30-year-old male has a body mass index of 29, body fat percentage of 14. So a lot of muscles, eats a lot of meat, works out 5 times a day. He has good muscle, but can do better. His cholesterol is high. Fasting insulin is 2-1. That's probably low level. He didn't put the unit. Should he take insulin? I think you have a lot of muscle mass. If that is you who has with a low body fat percentage relatively, I don't think you need insulin, but I need to see you. Insulin deficiency, you can see it on the body if you have a droopy triceps or droopy buttocks. That's typical for low insulin. So if you don't have that, you probably might not need insulin because the doses may be low of insulin because the lab has done the test too late. If it's you have to do it almost within 24 hours. Check the insulin or the test perishes. Here are low doses of insulin every day, and wouldn't that give you insulin resistance? No, it will not give you insulin resistance if your diet is good and you need insulin because the dose you receive here, I'm talking, is 2 to 3 units a day or 1 unit and not the 30 to 50 units diabetes patients take. So insulin resistance is a consequence of usually obesity. And if you don't have obesity, it's okay. But I don't give insulin to obese persons, except if have real diabetes, but otherwise no. You won't swell up neither. But if you're thin, you don't have enough muscles, you lose muscles quickly after stopping sports, you probably need insulin with such a low level if you have a low level. Thoughts on minoxidil, 2.5 milligrams for baldness. Minoxidil is like a lollipop. It's in place of a meal. It's too weak as an effect for baldness compared to the treatment I propose, taking testosterone, small dose, transdermal, plus 2.5 milligrams of finasteride or 2 milligrams, because some men get erectile dysfunction above 1.8 milligrams finasteride. Can you combine testosterone 50 milligrams finasteride 2.5? Yes, but you can also take minoxidil. I have even a local product formula that the pharmacy can make with minoxidil, with finasteride, with testosterone. That is the specific, and it goes back. You find the formula in my textbook of reversing physical aging. My fiance was taking testosterone injections, 250 milligram every week and every 10 days. So that's, yeah, for a man, yes, for about 6 to 7 months. And now his spermogram shows 0 sperm count. Yes. So high dose of testosterone decrease sperm count. But you don't have to be concerned. You can recover everything. I had a man who also had almost 0 sperm count. He stopped the testosterone completely. He took a stimulator of spermatogenesis, ACG, 2 times, I think it was 1,500 units or something per week. And he had 130 million sperm, which is very, very sperm, and he was above age 60. So you can he also had growth hormone that improves the sperm count and takes the azoospermia that your fiance has away. So I think growth hormone plus the stimulator and stopping testosterone, the stimulator also makes him make testosterone, but without lowering the sperm. So I don't think you should, or you should come back in consultation and at my clinic, for example, and ask an advice of my part if you go to one of the doctors that we can arrange that. Was the slide that showed male hair loss before and after was that cream or oral or injectable? This transdermal testosterone was liposomal cream that you put on the sides of the neck, above on the forehead, and then it penetrates. You put several layers. You don't put one layer because it always has to be a thin layer when you put it on places where you don't have any beard. So you put it here above the collarbone and maybe on the sides here, and you do that and with transdermal plus 2.5 milligrams of finasteride if they're young, but maybe 1.8 milligrams maximum if they might have erectile dysfunction, and then it works well. Yeah, there seem to have been problems with the French where they didn't hear the sound very well. How do you suggest someone take vasopressin? Vasopressin is given as a synthetic derivative 2 times a day. You have tablets of 100 or 200 micrograms, and they are normally used for oral use, but you never take them orally. You take them sublingual. You let them melt on the tongue. You take a quarter of a tablet of 200, you use 50 micrograms in the morning, 50 micrograms in the evening, and that's normally okay for most people. Some need more, but you just take twice a day sublingual. What are the optimal levels of DHA in women? It's about 280 micrograms per deciliter, which is the top level of a woman of 18 to 19 years. Then it's the highest levels in DHA sulfate, and that's the level. So it's DHA sulfate 280 micrograms per deciliter. That are the good levels. You find all these optimal levels in my hormone handbook, the yellow hormone handbook. What is the average daily dose DHA for men between 75 and 80 years? 50 milligrams in general. It's taken in the morning orally. Because if you swallow it, it goes through the liver, and the liver makes DHA sulfate out of it, so it's long-standing in blood. I'll give you the estradiol transdermal if the women have menstruation and low how postmenopausal women to make the breast form better. So in the postmenopause, that means after the menopause, you women don't need to have menstruation. And I give it from the 1st to 25th day of the month. I give in the morning estrogel or estradose or an estradiol gel of 0.06%. And I give about 1.5 gram to 2.25 grams, so 2 to 3 pumps. And in the evening, I give 100 milligrams of progesterone, micronized progesterone, the 25 first days of the month. And I stop 5 or 6 days. That decreases the risk of breast cancer greatly. To stop, not to take it constantly. I am not for the constant. Would IGF-1 and growth hormone be contraindicated someone with history of hormone-sensitive breast cancer? There are studies published that women with high IGF-1 have easier breast cancer. However, and I abundantly talked about it with the studies, is that it's the breast cancer tumors can make IGF-1. So it's a consequence, not a cause. And the breast cancer tumors have much less receptors for IGF-1, so they're less sensitive to IGF-1. So a reason more to think that doesn't. And women who have breast cancer, if they have high IGF-1 levels, they have less dangerous cancer, and they survive longer. So 2 different studies showing also longer survival for the second study. So I think you can take growth hormone. IGF-1, because of the fuss, maybe not, but scientifically, yes, surely you can take it. It's just that there's so many prejudice that I don't want you to be scared. But I think growth hormone is an anti-cancer. There's 50% less cancer in people who take growth hormone, at least based on a big study. Does doctor also treat PCOS? Yes, PCOS is you have also PCOS women have also much more plastic, so they have to take the pollution away. And it's treated by giving female hormones in small dose, by giving thyroid hormones, and by giving adrenal hormones like cortisol. Not so much DHA, less DHA, because they usually have a lot of androgens, and they can get rid of it. It's not difficult to treat PCOS. But it's also partly due to pollution, so you need to have a good diet too. What about women who want to quit oral contraceptives? Can it help with symptoms? Yeah, of course, we can do it without contraceptives. But you get a better fertility, huh? Don't forget that. One fasting with the hormones I give, one fasting 5 days per month, consecutive. Yes, it's consecutive days. I don't do it so consecutive. I do it like 2 days a week, 2 or 3 a week. But the study that showed 2.5 years of rejuvenation after 3 months was 5 days a month of fasting mimicking diet. Yeah, do I have to increase my dose of thyroid hormones during fasting? Not necessarily if it's 5 days, but if it's you fast for longer periods, maybe you might, because fasting decreases the conversion of T4 to T3, but it depends on your muscle mass. If you're low in muscle mass, generally you have to be suboptimal in thyroid hormones. So let's get out to what age can we start menopause? Well, it all depends on what you want for your life. You can also not start if you're old and you find you're far from the menopause, but there's no reason scientifically, because I looked at all the studies, not to take at age, to start a treatment at age 100 or 105, 110. It will make you live longer, feel better, but you have to start with low doses when you are with female hormones if you start later, and then slowly increase, because the body has been in negligence too long. You need to start low and slowly go. You have to always treat yourself with tenderness. Was the picture was before and after the ties a cream or injections? That's injections, subcutaneous injections, not a local cream. I do have a cream that I've conceived, or formula of a cream against cellulite that you can put locally, and that improves the muscles tone also at the same time. Then here in Spanish, yeah, you can have the video later on. And there were problems also in the hearing of the sound in Spanish, apparently. What about ceramide for skin? I don't know about ceramide in the skin. Sorry, don't know everything. Do I have books in Spanish? I have a book, a general public book in Spanish, yes. But that's all. It has been published by a Mexican editor. You give certificate of attendance, not for, we give certificate of attendance, of course, in our workshops, but not in for this free webinar. Can you ship international? We don't sell medications. We can ship international books, and that's certainly, and that's not a problem. As these products, European Union organic certified, are they comply with European regulation? I think it's, they talk about the German products from Sunday Natural. Yes, I think so. They are certified to the US. I don't know if Sunday Natural sends to the US. Maybe Olivier, you can answer that. My eyes are very red and yellow. How can I reduce that? Well, we have to see, first find the cause. There are several nutrients that can be low, but if you really have yellow eyes, means the liver doesn't work well. Red eyes, inflammation. If you want to get rid of the red eyes in 3 hours, you take 3 to 4 grams of fish oil. You have anti-inflammatory diet. That means you don't eat bread and sugars, and you will get rid of your red eyes probably in 3 hours. The yellow eyes is something more difficult because it can be due to an accumulation of beta carotene, because you're low thyroid. Thyroid hormones increase the conversion of beta carotene, provitamin A, and vitamin A, and then you don't get yellow. So you lose also the yellowish of your soles and of your palms and your skin. However, you can also be yellow because there's a liver problem, so we have to check the liver. My androstenedione is low, and I use some adrenal gland deodorant. I feel good in. If you feel good energy with whatever product, it's okay. But with adrenal glands, the roles, they are not with the hormones. They're with the environment. And so they always have 10 to 20% of the effect of hormones in my experience. So it's better to take the hormones. Any treatments for vitiligo? Well, it's not 100% yet good, because I can make you 50% less vitiligo by putting cortisol and an anti-yeast cream on your skin, but it doesn't pigment homogeneously, so it's not beautiful to see. But the vitiligo is, in my experience, a yeast infection result. And so you have to stop the dairy product, the milk products, otherwise it continues. And you will stop continuing to have vitiligo if you stop dairy products. That is really, that means yogurt, cheese, milk. Why can DHA cause hair loss in women? Because they are too low in female hormones. So you cannot give DHA to women without giving female hormones. That's my experience. For back pain, what do you recommend? For back pain, even if it's very bad, if you take growth hormone and IGF-1, growth hormone and testosterone injections, for example, you will get rid of that back pain. However, there are many other methods like a massage gun, reverse table where you upside down, that also help. And I usually give for back pain vitamin B12 injections, one every day during 12 days, and the back pain is gone. It repairs the nerves that have been damaged. But Usually you have to do several treatments, but the B12 injections really work well after 12 days. Do I have to take a treatment hormonally at the menopause or not? Of course, you should take a treatment. You should even take a treatment of female hormones before menopause, well balanced, of course, because it has to be well balanced to be safe. But of course you should, because then you live 4 to 5 years longer just by taking at the beginning at menopause. You start earlier, probably more years. How high should be the concentration of melatonin oil be? Well, I think Manon of the Nelly Diverse organization said that it was 0.03%, I think, is enough to have efficacy. Is there someone in Italy specialized in hormone therapy, bioidentical hormone therapy in Italy? In Italy, there is at least there's a doctor, but forget his name. Was a good friend in the times, but I didn't see him since long. But there's in Milan a group of several doctors that do it. So you should go in Milan and you can maybe ask, we can maybe make a research to our email. That said, the channel at hertoghe.eu or the secretary at hertoghe.eu. For women who had a hormone-sensitive cancer, are all the hormones you mentioned contraindicated? No, the hormones are not contraindicated. A hormone-sensitive cancer is a cancer that is probably breast cancer, I think in this case, is a cancer with a lot of hormone receptors, progesterone, estrogen receptor. That means it's not a dangerous cancer. It's a less dangerous cancer because it's still very differentiated. And studies have shown that women after breast cancer who take female hormones have, on average, 30 to 50% less mortality in the next 5 years, and they have less recurrence. Okay, we're going to stop soon now. And for un adolescent who has TDAH, that's in French, qui a des seins, peut-on lui donner this? I don't know what TDAH is. It's probably attention deficit disorder, probably. And it's probably a boy who has some breast. Can we give this? You can give testosterone, but don't forget testosterone can convert to estrogen, and that this adolescent probably has milk glands, and if testosterone converts to estradiol, he has have more milk glands. So you have to put locally some dihydrotestosterone, and if you provide testosterone, you should probably provide with an aromatase blocker like Arindex. And the testosterone will be very small dose. If you give systemically 50 milligrams transdermal in a liposomal cream, and the Arimidex will be something like a quarter of a tablet of 1 milligram per day. And then you will have less breast formation. Do you have a list of practitioners in Geneva that do same work? I think in Geneva it is not so good. I think there's somewhere near Geneva, I think it's Lausanne. There's, I think, a Dr. Houdon that does this type of medicine, or did it 10 years ago. I'm not sure he still does it, I suppose. Yeah, here it's in Spanish, and a filter that takes out the magnesium of the water. Yes, that's osmosis reverse osmosis filter. It takes all the minerals away, so you need to add it after. Here's an anonymous person, 41 years, and people say I look like I'm 25. Wow. He said, it's normal. Slim, fit, I take NAD, GABA for 7 years, and I don't drink, smoke, or have. Still, I have hair loss, and I sleep very badly. What can help? So people sleep badly, live less long. So I think you look 25, so that looks good. But do you have a beard, or if you're a man, because it's not specified here? Because if you can look younger because you don't have a beard, and that means you're low in testosterone. And if you don't sleep good, it's because you have a lack of melatonin and a growth hormone at night. And maybe you do things that decrease melatonin. So if you drink coffee, you want to caffeine substance trace can stay up to for 6.5 days in blood. Some people can retain. So you have to stop all coffee you have probably to take a small dose of sublingual melatonin, like 0.1 milligram, and a precursor of melatonin that converts to melatonin 4 hours later, like 5-HTP 50 milligrams or tryptophan 500 milligrams. And that will help. And maybe you need to have growth hormone. Estradiol, because that makes you sleep very deeply. Estradiol cream for face, yes. I just talked about that. Estradiol, and I think we have here enough. I think we're going to stop because otherwise it's going to be too long also for the reproducing. But I went to many questions, but I think I'm just at half of the questions. I thank you for your questions. And maybe next time, if you're one of the first, I'll be able to answer to your questions. We'll have a webinar begin of autumn or in September. I'm not sure. Look at the dates. It's probably in October. I hope you were satisfied. And I thank you for your best attention. I thank all our supporters, also the firms that really help us to disseminate the message. Without you, we cannot do much. So thank you, and thank you, and thank you for assisting. Bye-bye.